he will enjoy foods that are healthy for him. As you know, cholesterol is the chief problem you have to be concerned about as far as developing coronary occlusion and coronary disease is concerned. If your cholesterol is under 140, very, very seldom that anybody has a heart attack with a cholesterol of 140. Now, the factors that influence your cholesterol are things that we should know about.
But is there an easy way to keep your cholesterol under 140?
As it should be lowered. The easiest way to get your cholesterol down is to...
Most of us aren't even aware of how easy it is to avoid heart attacks.
We have a lot of information in this country which is not being applied, which would greatly reduce the incidence we have of course.
Before we dive deeper, don't forget to subscribe to the channel to stay updated with our latest content. If you're enjoying the video, smash that like button and show your support. Also, drop a comment below to share your thoughts, experiences, or questions. We'd love to hear from you. And make sure to hit the bell icon so you never miss an upload. Few people with cholesterol levels under 140 suffer heart attacks. But how do you maintain low cholesterol? The solution lies in what you eat. Many are unaware of how small dietary changes could prevent heart disease. Despite access to research and guidelines, we aren't applying them effectively to reduce the risk of heart attacks. Today, we'll explore insights from Dr. Ellsworth Wareham, a 104-year-old cardiac surgeon who dedicated his life to heart health. He'll share 5 common foods that elevate cholesterol and lead to heart disease. The final item will surprise you. Today, Dr. Ellsworth Wareham, an esteemed 104-year-old cardiac surgeon, uncovers 5 dangerous, research-backed foods that significantly elevate cholesterol levels and increase the risk of heart attacks, saving the most startling one for last. Dr. Wareham warns against dairy, a staple in many diets. Research from PubMed Central shows that consuming more than 200 grams of dairy daily increases the likelihood of heart disease. Milk's casein protein, along with other dairy components, raises LDL cholesterol. The European Journal of Preventive Cardiology reports that heavy dairy consumption is linked to higher risks of stroke and premature death. Cutting dairy out of your diet may significantly reduce your cholesterol. Luckily, there are many non-dairy alternatives today, making it easier to avoid this hidden danger.
Even the casein of the milk will raise your cholesterol.
Saturated fat is another enemy of heart health, found primarily in animal products.
One of the factors is the amount of saturated fat, and most animal fat is saturated.
According to a Harvard study, diets high in saturated fats contribute directly to heart disease. Even if you exercise regularly, it won't offset the cholesterol spike caused by these fats.
You can keep your cholesterol under 140. Your chances of developing coronary disease are very small. Exercise is beneficial in reducing your cholesterol. But if you're taking in a considerable amount of saturated fat, you can't exercise enough to lower it as much as it should be lowered.
To protect your heart, avoid red meat, butter, cheese, cakes, and ice cream. Experts recommend keeping saturated fat intake under 10% of your total calories. Instead, switch to healthy fats like omega-3s and omega-6 from avocados, walnuts, flax seeds, and extra virgin olive oil.
High intake of sugar will affect your cholesterol.
Next on the list is sugar, which contributes to non-alcoholic fatty liver disease, a significant heart disease risk factor. Excessive sugar consumption disrupts metabolism and bypasses your body's satiety signals, leaving you craving more. Over time, sugar leads to obesity, insulin resistance, and metabolic syndrome. Reducing sugar intake, especially from processed snacks and sugary drinks, is crucial. Swap sugar with natural alternatives like stevia to lower your risk of heart issues. Salt may seem harmless, but excessive consumption increases cholesterol and raises blood pressure, putting your heart at risk. Processed foods like chips and deli meats are loaded with hidden salt, contributing to hypertension and cardiovascular problems.
There are a lot of people that take too much salt, and their food they think is flat, unless they have a lot of salt.
The World Health Organization recommends keeping salt intake under 2 grams per day for optimal heart health. You can gradually reduce salt in your diet. Your taste buds will adjust over time, making it easier to enjoy meals without needing as much. Finally, Dr. Wareham warns against processed oils, which promote oxidative stress and inflammation. Oils like soybean, corn, and canola contain high levels of omega-6 fatty acids, which can disrupt the balance between omega-3s and omega-6, fueling inflammation. Even products marketed as trans fat-free margarine can still contain harmful trans fats.
If an individual is willing to listen, I will try to explain to them on a scientific basis of how I think it's better for them.
Dr. Wareham recommends avoiding these oils and opting for healthier alternatives, such as cold-pressed canola oil, virgin olive oil, or avocado oil. Surprisingly, butter is another food to avoid. Although coconut oil also contains saturated fats, studies show that butter raises LDL cholesterol even more. If you have weight or metabolic issues, switching to minimally processed oils will better support your heart health. By eliminating these 5 foods, dairy, saturated fats, sugar, salt, and processed oils, you can significantly reduce your risk of heart disease. Dr. Wareham dedicated his life to inspiring others to embrace healthier habits, and his message is clear. With the right diet, it's possible to prevent heart attacks and promote longevity.